Hi, I am Fulton Kornack, a board-certified orthopedic surgeon and medical director for advanced patient care. I am associated with the Massachusetts General Hospital, the Faulkner Hospital, and the Harvard Medical School in Boston, Massachusetts. Since 2007, advanced patient care has focused on products that will reduce the risk of surgical site infections, as well as medical adhesive-related skin injuries. Costs associated with these problems include 13,000 lives lost and between $7 and $11 billion spent per year. This does not include the cost of human suffering. Airborne pathogens, dressing changes, and hospital hosts are major causes of surgical site infections. 50% of hospital surgical patients experience MARSI from the removal of tape, with an associated 8% infection rate. The Advanced Patient Care GentleOne represents a dressing platform that allows us to address multiple wound, tube, intravenous line, and incision applications across diverse medical and surgical specialties. Let's take a look at how Advanced Patient Care has developed products to reduce risks and costs. APC offers both the GentleOne dressing for most chronic wound treatment and the window to the wound dressing for most surgical procedures. Together, they offer me the management tools necessary to treat the wide variety of wounds and incisions that I encounter each day. The APC dressings offer me the dressings necessary to manage my patients effectively, safely, and compassionately. It helps me to reduce complications, in particular MARSI, offering me unparalleled access to the wound during the entire postoperative process. For total hip replacement, the window to the wound option provides a dressing that protects the wound but allows for constant wound observation without disrupting the sterile integrity of the initial intraoperative application. In addition, an antimicrobial option is compatible with this dressing if the surgeon feels it is necessary additional treatment for a particular wound. Application of the window to the wound dressing is simple. At the end of the procedure, the wound and surrounding area is cleaned and dried in the standard fashion. It is necessary that the surrounding skin is dried well to enhance adherence of the base to the skin. The circulating nurse will then open pouch number 1 from the chevron end, which is the starter dressing, including both the base and the cover. The starter has both hydrocolloid base and a polyurethane cover combined for ease of application. Application of the window to the wound on a hip incision is very simple. The right hip incision has been closed, the skin around the incision has been carefully dried, and the backing is removed from the dressing on both sides. The dressing is then carefully stretched over the incision and spread out smoothly and applied to the skin. It is very important to run your fingers around the edges to make sure you get proper adhesion. This should be done a couple of different times to make sure that adhesion is total. This then represents an intact dressing. It is sterile, protected, water resistant, and allows real-time observation of the wound. If for any reason, whether there's a change in the wound, excessive drainage, that the wound has to be accessed, the tabs on the lower part of the dressing are lifted. A finger is placed on the base to support the hydrocolloid, and the window is carefully and smoothly retracted. The wound can then be exposed in a fashion that allows for treatment, application of xeroform gauze, or an antimicrobial pad if necessary, and the same window can be reapplied back over the top and smoothed in place, still maintaining the sterile environment and the protection that we started with. The intact dressing without complication can stay in place for 7 days and can be removed in the doctor's office. It allows protection during the entire hospital stay and postoperative period. This intact primary window to the wound dressing in an uncomplicated wound protects the wound from airborne pathogens, multiple dressing changes, and the hospital environment. In the uncomplicated wound, it can stay in place for the full 7 days and be removed in the doctor's office. As we showed before, at any point in time, the window can be removed simply by pulling the tabs back. Additional treatment can be done. If the window itself has become soiled or problematic, it can be removed in its entirety, leaving the base intact so that there is no damage to the surrounding skin, and a new window can be applied, which is present in pouch 2.
9 days ago, Dr. Kornack performed this procedure using the window to the wound dressing. I'm going to simply peel this dressing back, and you will see how easy the removal process is. You can see the peripheral skin is in very good shape, and you might see the imprint of the dressing in the base.
The window to the wound is applicable to incisions on the hip, knee, spine, abdomen, and even some extremity indications. As part of the overall APC wound care management system, it provides an excellent wound care solution to the orthopedic surgeon as well as surgeons in most other specialties.